Hello, this is Heidi Rickard. I am a certified nutritional therapy and holistic health practitioner and owner of Nourish and Revive in Linwood. We're here today with Dr. Kayleigh Short. She is a holistic dentist and owner of Wholistic Dental Care in Mukilteo, Washington. Some of her credentials and education include in 2013, she graduated from the Arizona School of Dentistry and Oral Health. She has advanced education in general dentistry. She has a certification in holistic kinesiology. She's SMART Amalgam Remove certified, PRF Facial Aesthetics certified, IV Nutrition certified, Craniosacral Therapy certified, and Photona Laser certified, and more. I hope I said all those things correctly. Well, welcome, Dr. Short. It's so nice to have you.
Thanks for having me.
You're welcome. What else would you like to tell us about your bio, or a little bit about how you came into holistic dentistry?
Yeah, those are all the titles on paper, but really the journey's been unique, as all of us, through our own wellness journeys. I feel like it kind of leads us to these other modalities that are often outside of what we would consider the norm. But when I was in dental school and throughout my whole childhood, I had dealt with severe migraine headaches, among other things, but those were the most debilitating. And as I was going through the dental school process, I was noticing they were worsening, and not from my normal reasons that I would get them, my normal causes. My family, through a series of events, was introduced to Dr. Jay Dunn, who is responsible for founding Holistic Kinesiology. And luckily, I was a flight away from her. So I went back and forth for my own care for years, as well as my family, and just saw dramatic improvements. I saw wellness that I'd never experienced before. And anytime that I felt myself going down that kind of like brain fog, exhaustion, migraine phase, it always came up as heavy metals. It was always mercury related. And suddenly realized there was a correlation to the career I was choosing and my wellness being impacted, because the silver amalgam fillings that are used still in dentistry today, that I was still taught to place, release mercury. So I was exposed to it all the time. But luckily, she kept me going, kept me functioning. I finished dental school, went into a residency program, and decided to take her kinesiology course at the same time. So my heart and my passion were always in this holistic wellness path. My education and first part of my career was in the opposite direction. So they never really aligned. And I knew that if I was going to continue in my profession, I had to follow my passion. I had to follow the truth of this holistic wellness. And so another series of events led me to a holistic practice in the Seattle area, something that I thought I'd have to build from the ground up. I didn't realize that amazingly people had started to pursue this already. And I met some incredible people along the way, great mentors, great coworkers, and a couple of us decided it was time to branch out and follow our passion, have no limitations with the modalities and the procedures that we could make available, the technology. So we're just trying to be as expansive as possible to really help people with no limitation. We're open to any avenue and wanting to just learn and absorb as much as possible to provide the best care for patients.
Oh, that's wonderful. And why would people choose a holistic approach? Why you, Dr. Short?
Well, unfortunately, most people, you go to the standard dental office and you get your cleaning and you see a dentist for a few minutes. They tell you what you need. You may or may not come back. A lot of people have a lot of fear behind dentistry due to some sort of trauma or a story that they've heard from someone, unfortunately. As well as a lot of our patient base comes to us when they're recognizing in their wellness journey, oh, I have these metal fillings. How do I get them out safely? Or my naturopath said that we've done everything we can, but I'm still not having the result I want. Maybe it's something going on in my mouth. People find us for all different reasons, but usually it's no one else listened to me. No one else understood. No one else had the time in their busy schedule with the layout of a typical dentist office to really be heard. And so luckily we open our doors and we plan for that time. We coordinate that time. We ensure that patients are heard. And I think the really unique thing that this office brings that most other holistic places don't, most of them have amazing technology, phenomenal providers, but we also bring in the perspective of treating the whole body in the sense of like the energetic level also. So emotion work is a big passion of mine. Do a lot of EFT clearing, meridian balancing, chakra balancing, try to acknowledge the whole body. A patient will sit down and discuss, one of my first questions is, did something happen previously? Is there something specific that has created this anxiety in you, this unwillingness to come for 20 years to the dentist? And there's always a story. And so luckily, most all of my patients are very open to using the modalities that we have to try and move those blocks, those energetic blocks, so that coming to the dental office is not a fearful event. It's not a painful event. We really have done everything in our power, and we'll change it as much as we need to create as safe a space as possible for ourselves and our patients. I think it's a downward flow of, are we happy? Are we safe? Are we healthy? Can we offer that to our patients?
That's wonderful. I do refer all of my clients to you, as you know.
Thank you so much.
So much of a turnaround in people's mentality when they go see you. Oftentimes I hear, well, I'm really scared, or I have this fear, or I had this traumatic experience, and they go see you and they're like, that was just so enjoyable. It was easy. She cleared my fear of dentistry. And I'm just like, oh, that sounds wonderful, because we know so much of health just starts in the mouth. You can detect so many illnesses and ailments from the oral cavity. I've seen it myself, where some of my clients, if they have mercury still, it may affect their thyroid. It may give them leaky gut. It may give them achy muscles or joints, or other types of things. And so I'm just so thankful that you can remove mercury amalgam safely, and also recommend people like me for a follow-up program as well.
Oh, absolutely. Before and after, as we've worked well together in the sense of making sure we're relying a lot on muscle testing also, which is a phenomenal thing that we can provide to coordinate treatment, to make sure we're taking out only the ones, in that event that are safe to be removed. How many per visit, how much time to heal between visits. It's very important, as well as we see amazing correlations between teeth and organ systems. We actually had a patient today who had gross decay, a lot of cavity in a front tooth. And we looked up at the organ chart later, and it's very connected to the kidney. And his report back was, the doctor told me I have kidney concerns. So, where did it start? Was it the kidney or the tooth? Of course, we can muscle test that also, but we're making those connections, and those are the moments when a patient looks and the spark triggers, and all of a sudden it's like, oh, okay, these are elements that most people aren't thinking about. They're not talking about, and wouldn't put together if they didn't have the opportunity to be shown this.
That's wonderful. I just love your holistic approach. I know you're going to give us a tour of your clinic. I'm excited to see that. But do you have any last minute tips that maybe something that people don't know about holistic dentistry, or maybe a tip about their dental health that they should be doing every day? I don't know. What a little pearl of wisdom can you leave with us?
Oh, I mean, obviously we want to see you, and we want to be able to recognize those things that maybe no one else has ever come up with before. I think that we've got some phenomenal modalities to really help in everyone's wellness journey. I think everyone should be seeing a holistic dentist and have that perspective. Like you said, the mouth is the first entry point. I believe you're doing this also, but we do, I think the most informative thing for patients are plaque slides. We actually show you your bacteria in your mouth and give you specific tips and techniques on how to take care of your wellness, literally from the bacteria onward. And in addition to that, we can really individualize your wellness with muscle testing, supplement support. And we're actually adding the additional benefit of natural facial options too, when it comes to, microneedling and laser techniques and things like that. I know a lot of people, the whole body is all connected. So if we can have you happy on the exterior and looking confident, we've got a lot of options for people all the way around. So come see us and we'll see what we can do for you.
Oh, that sounds wonderful. And I will. Well, thank you. This is Heidi Rickard from Nourish and Revive signing off.
Here's a quick tour of Wholistic Dental Care. We're trying a new concept of shoe covers or shoes off, so everyone can keep this area clean, feel like they're at home. Got some beautiful refinished furniture and entryway from one of our assistants, Jen, and some great Dr. Marder art on the walls. This is our original Dr. Marder artwork that kind of created the whole theme and logo of our office. Coming on through, we have what will be our post-surgery IV facial quiet room. Still a work in progress here. And we've got our hygiene area, a lot of new technology, lasers, airflow, guided tissue regeneration options, iTero, our beautiful view, fairies going back and forth all day. We got a couple of operatories for procedures, surgery, Ozone set up just to make sure we've got the best options, the best care for all of our patients. This is our sterile area. And more technology is a new cone beam, low radiation. Great option for some important diagnostics that we're doing for our patients.